So basically you start at this school. It's the only option available to you. And the first night, the first thing they do with you is put you into a category of stupid, smart, brave, or evil. How do they not see a problem with that?
Yeah, I guess I never thought of it that way. I think that, yeah, I wouldn't put my kids in Hogwarts either.
It's a bad school.
Yeah.
Homeschool your wizards.
Yeah, fair enough. That's a good point.
Well, welcome everybody. Welcome to the Back to Basics podcast. This is a podcast where my brother's an ER physician, and I am a paramedic firefighter nurse, and we take what are sometimes considered to be complicated medical topics, and we break them down to the basics and make them easy for you to understand and digest. Chris, what are our sponsors today?
So we have one sponsor today. It's Elite Medical Training. Elite Medical Training is a emergency preparedness training company similar to what we've been doing out in the Michigan area. They are a national company out of California doing emergency training stuff. So check their stuff out. We want to appreciate that they sponsored us today, EliteMedicalTraining.com. Again, thank you guys so much for being a part of what we're doing. So why don't you then tell me what the topic is today?
So your favorite topic, we're going to talk about snakes.
I hate snakes.
Spiders and scorpions.
That's horrible.
We're going to talk about envenomation today.
Envenomations.
So what happens when you get bit or stung by something that injects venom, and then how do we go about that? Because there's a lot of like kind of wives' tales, if you will, about like how to like solve these situations, like from a first aid standpoint. But I like to go a little bit deeper and just kind of understand what's going on in the body when this venom hits us. And then what can we do about it as emergency providers, and what's the hospital going to do about it, eventually. And what's funny, I'm glad that I got here today before you did, because my buddy
if you brought a
viper.
No, shut up. You did.
Just kidding.
Oh my God. That would be, I would have lost.
Did you really believe it though?
No,
did you really
but,
think I did?
No, but there was a part of me that like there was a little like pit in myself.
I could see it.
So for
Chris
our
hates
listeners,
snakes.
spiders, I don't really care. I don't like them, but snakes, I can't. I mean, I was even now with my children when I go to the zoo, and I'm not making this up. I'm not being dramatic. When I go to the zoo with my children, they want to go in the reptile house. I put my head down and I look at the floor while we walk through, and they know to like not. They try to make me look at stuff, but I won't, because even as a grown man, if I see like one of these snakes in the zoo or something like that, I mean, even if I see like a garter snake and I wasn't expecting to, I'll have nightmares for like 3 weeks.
I feel like nightmares for 3 weeks is a little much, but I feel like everyone should have a little bit of like I don't like snakes. Like,
yeah, I mean, you should have a caution. But mine is like, I remember like in school they'd like bring a boa constrictor in to show you at the front of the classroom, and I would like get up and like I'd have to leave the room. Yeah. I am terrified.
So I recently heard a story from some of my firefighter buddies.
This is gonna give me a nightmare.
This one guy worked down south.
So
like you take showers at the station.
Yeah.
And they like a common joke is they would take a snake and they'd throw it into the shower while they're in the middle of the shower.
I'd lose it.
Can you imagine me naked, exposed, and a snake's at your feet?
No. I would lose.
Like I think about that every time I go in the shower at work.
Yeah.
I'm terrified that that's going to happen. And if it does, like the kind of revenge that I would have on these people would be so extreme. Like they basically know like that's off limits. Like
right.
you didn't just like we're no longer friends. Like I'll burn your house to the ground. Like that's the kind of response, because that's what happens. I escalate with pranks and in dangerous ways if you've offended me.
And this is the problem too, is that like I feel like there was a part I remember as a child when I was probably like middle school being like, I need to overcome this fear of snakes, right? So we were like on this nature trip with school and they had a snake, and I'm like, you know what? Overcome your fears. I remember like dad was there with me like on this like field trip, and I was like, overcome your fears. And I just like reached out, because you're allowed to pet it. I reached out and I touched it. And I'm not joking you, like that was the time I had nightmares for days and days.
I'm similar. See, I'm not that terrified. I've had the bulk. I've put the bulk constrictor on your neck. Get over it. But I don't like when the face is looking at me.
Oh God, no, man! That's seriously.
No, but that's what's so creepy is like it like put it on. And I'm like, oh, it's not so bad. Like it's just moving, like leathery thing. But then the face is like coming up at your face. Nope. Anyway, but I was doing the research for this stuff last night, because that's how prepared I am for podcasts. But I was doing a lot of some of the background research, and I was on like these like peer-reviewed articles, and I was looking over just kind of like Envenomation, like let me refresh my memory. And there was like pictures of snakes and stuff, and I was I couldn't get to sleep last night. Like I literally could not get to sleep last night until like 1:20 in the morning because I don't like them.
You just don't know.
We live in, this is worth saying.
We live in Michigan where like
there's like one snake
like
we have to worry
9
about.
months out of the year. It's like too cold for snakes,
It's
and
like
I'm still
Ireland.
like, man, what if it's in the wall? You know what I mean?
Right.
Like, what if it's
Yeah.
under my bed? Like, yeah, it's free.
Yeah.
And then like we're digressing a little bit here, but another thing, and this is if you're not afraid of snakes, like you should be, like way more afraid than you are, in my opinion.
Yeah.
And this is why I decided to like you just like know your enemy, right? So like I know a lot about snakes, just so I can probably avoid them. But I was okay. This is a cobra, a king cobra.
Yeah.
Can no joke stand itself up the height of a full-grown man and move aggressively fast forward.
Oh, they're super fast.
That is the
you cannot run them.
Could you imagine you're just looking and feel, and all of a sudden this cobra just
eye
pops
level
up
is coming at you
and just like is literally running at you?
Yep.
I would kill myself. I'm gonna be honest. I would just end my own life. I would not let it get to me. If I held the only option, I would just in a heartbeat. Even if my family was there, I'd leave them.
Oh, yeah.
I was hiking with my wife, and there was a baby rattlesnake, and I ran away. I left her. I ran away, and I didn't even warn her. She just saw me all of a sudden turn and run and leave her there. I mean, fend for yourself at that point. There's not. Anyway, we should probably start talking about.
Anyway, what I was just getting at is the research alone was scary. I don't think there's anything wrong. Like, no, there is. If you're someone who likes snakes and you're into snakes,
we can't. Be
I
friends.
don't care if I lose your business. Don't listen to this podcast. It's not for you. I don't have any respect for you. I don't understand you as a human being. I just don't care. Like if I lose 20% of my business to people who like snakes, I'm fine with that. Like I'll stand by
There's
that.
just like a survey question we asked when we're like doing business with people. Like, do you like snakes? They're like, yes. We're like, get out of here.
Get out.
Just get out.
This isn't for you. All right. So anyway, I think that covers our intro. We next wanted to talk about so just some common North American venomous creatures. So we're not just talking about snakes today. They're our least favorite, but we're talking about anything that can inject venom. So why don't you explain what is the difference between poison and venom? Very simple difference. Do you know?
I don't know what you're
so here-
getting at.
let me
So
tell
go
you
ahead.
the
Yeah,
difference.
please. Yeah.
Poison, well, venom is injected, right? In order for something to be venomous, they have to be able to inject the venom into you.
Okay.
So it's bites and stings.
Okay.
Versus
okay.
poison is just like you can like drink poison, you can, you know what I mean?
So it has to be
There's like
injected.
there is poisonous glands on like frogs that you touch and you can absorb it. So poison is absorbed, venom is injected.
Okay. So would like bee stings? Well, I guess they don't have
not
venom.
poison.
We should cut that part out.
No, I like it. It makes you look like an idiot, and every once in a while you need to be humbled because you're the fancy doctor.
I'm just trying to think of other things that sting and inject, but I guess that's what we're talking about. Literally is.
I mean, I could be wrong. I'm fairly certain that's the big difference between poison
Yeah,
and
no, you're
venom.
right. You're
Okay.
right. That makes sense.
Making me nerd out about this bad preparation I did last night because I was so terrified. Anyway, we're going to talk today about more North American issues. So to our international listeners, the four of you, to our international listeners, this information about venom is still obviously important.
Yeah. But we're not going to talk about king cobras.
We're not going to be talking about
and
stuff that
all
we
this
don't
kind
see
of
in
stuff.
North America. All right.
And then I say that I don't even know. Can king cobras are they venomous? They've got to be, right?
I think they spit poison, don't they?
That makes it worse. I don't.
Yeah.
I don't want to talk about that at all.
So anyway, yeah, I believe they spit. They have poison glands and they spit poison as opposed to
So you're telling me
biting and injecting. So they're not technically venomous.
I don't want to talk
really
about.
know.
We're not going to talk about king cobras. I refuse to talk about king cobras.
All right.
Go.
So here's what we are going to talk about: North American stuff. We're going to talk about pit vipers,
Okay.
coral snakes,
Okay.
black widows,
Got it.
brown recluses,
Okay.
and a certain type of scorpion called a bark scorpion.
Okay.
Okay, we're Midwest, like we don't really deal with scorpions.
Yeah.
But these are the venomous,
these
are the major venomous things that you'd have to worry about in
North
North America.
Got it.
All right?
Right.
So, first and foremost, pit vipers, our least favorite. Do you know anything about pit vipers? You
Pit
told me you were a
vipers, I
snake
know
expert.
that you. I was a snake expert. No, so pit vipers, they have a different head shape and different like.
So they are typically a
You can- that's how you can-
triangular head shape
Yep.
because their venomous glands are so swollen.
I hate that.
So because they store their venom in those glands, that's what gives them kind of that triangular shaped head.
So pit vipers would be things like rattlesnakes.
Yeah, rattlesnakes are a very common type of pit viper. Water moccasins
Mm.
and copperheads are the other two.
And
So let's talk
they
about
look different than coral snakes because of this. Well, they all have. venom glands,
What
right?
looks different than coral
Their
snakes?
heads. Their head. That's how you differentiate between like a pit viper and like a coral snake.
Yeah,
Their head.
coral snake is just like it's completely
like a
cylindrical
flathead.
and it can swim.
You could swim, man. Don't.
Yeah, there's
No, I can't even
the
swim.
stuff I saw last night. I can't explain it to you. Anyway, so some things in terms of pit vipers, some things to identify them. They'll all have slit-like eyes, like their pupils will be a slit. That is common to just pit vipers, not all snakes. They do have that triangular head due to venom glands. And then there was like all this information in this article I was reading about like how the scales go. I didn't even understand what it was talking about though. The scales do like a certain thing. Like
If
they're
you're
not
that-
like
if
it's
you're
not like
that
scales
close-
next to each other. It's like scales like going over like armor plating sort of
If
thing.
you're
I
that
think.
close, you're the victim at this point. So I feel like,
Yeah.
ask the victim what the scales.
Yeah, like
look
don't get close enough to the rattlesnake to like identify whether its scales are the right direction or
Right,
whatever, and then get bit. That
So
seems
all
just kinda
pit
dumb.
vipers. So there's types of pit vipers, like you said,
Yes.
like rattlesnakes and water moccasins and what was the other one?
Copperheads.
Copperheads. All pit vipers are venomous. That's why we put them into the category of pit vipers because they're venomous.
Yes.
Correct. Okay.
Yeah.
It was a rhetorical
Yeah,
question.
it's those three. Those are the
Yeah,
three
yeah.
pit vipers. I don't think there's any others.
Right, and that's why we categorize them because pit vipers have those. You can identify them by those features that you spoke on, and that means you know that they're pit vipers and they're venomous.
So, rattlers, they have rattles.
Mm-hmm.
That's usually to warn you that they're going to bite you.
Mm-hmm.
However, some rattlers don't rattle, and some like hikers just get by people by rattlers that don't rattle at all. Like they just didn't bother. So like. You don't have to
They're like
don't
stealth,
count on the
like stealth rattlesnakes. Is that what we're talking about?
no, like you can't count on them rattling to know that they're like around. Like you might just walk and step on.
Well,
one
and that's
it
why
bites
they,
you.
like when you're hiking in like different national parks and stuff like that, where they have like they say like don't go off the trail, don't go climbing on rocks because they'll sit up and sunbathe and you're gonna grab them. And
Yeah.
I don't hike because of that. No, I do.
I hike, but I've never seen the surrounding scenery. If there's snakes in the area, I've only ever seen the ground when I
Well,
hike.
I don't know if you
It's different ground.
different
That's
ground.
what I see.
It's always different ground. No, but I don't know if you remember. So when you and I went mountain biking in Colorado, and do you remember we were out?
We heard one.
Yeah, because we had like taken a quick turn and then had stopped or something, and then we heard one like very close off the trail rattling. And we were like, I was gone.
And then you
after
thought about that the rest of the week long trip.
Yes, exactly. Yeah, that was it for me.
Yeah. So anyway, rattlesnakes, right? Then copperheads are named copperheads because of their copper-colored head. All right. I'm gonna be honest with you. I don't know if I'd be able to recognize a copperhead. It looks like a snake to me. I don't like snakes. I'm already gone. And then water moccasins, also called cottonmouths. These guys can swim, and the way they swim, man.
You watched them
I watched some
swim?
videos.
Nope.
It's really spooky. So anyway, they can swim, and then they're called cottonmouths. I didn't know this. When they open their mouth, don't get that close. Their interior is white.
Okay.
So that's why they call them cottonmouths. It's like they got cotton in their mouth. Next, besides pit vipers, we also have coral snakes are the next like major venomous one that we have to worry about in North America. So coral snakes, you guys might have heard this. They have basically red, black, and yellow stripes, and there's the whole phrase that's like red on yellow, kill a fellow. Red on black, venom black.
Yeah.
Guess what I learned last night?
No.
Not true.
What?
There are like depending on where you're at, you can have the red or black, and they're still venomous.
So again, this is just.
It's
I
just
mean,
like
we can sum
someone
this whole,
came up with these general dumbass rules that like,
Yeah.
don't even apply in all cases.
We could just end this conversation right here. In my opinion, though, just don't go buy snakes. Period.
Snakes are everywhere.
Snakes are everywhere. Don't leave your home. You got
They
Amazon.
can get in your home.
You got ships
Have you
now.
ever seen the
Don't.
TikTok? Okay,
No.
never mind.
No.
All right. Anyway, those are snakes. Other venomous creatures. Let's stop talking about snakes for a second.
Well, actually, let's keep talking about snakes a little bit. Only because so
You're the
one
expert.
thing that one thing that people most of the time. So obviously, like snakes don't have venom so that they can bite humans. They have venom so they can stun their prey. Most of the time, there's such thing as a dry bite, and there's such thing as a venomous bite. So most of the time, when you're bit, if they're trying to protect themselves, they'll dry bite. They don't inject the venom. Or they only inject like a very little bit. Because if they and where you're going to run into big problems is because if they were to bite something and inject all their venom, they now have no
They'll
venom
die
left.
like bees.
Nope, that's not true. No, but what'll happen is they have no venom left, and now they can't hunt for food for like a while.
Oh, wow,
So they only
okay.
inject a little. Like if you're gonna bite a mouse, they inject a little bit of venom,
And they do that to paralyze the mouse, kill the mouse, and then they can eat
and
it.
then they can eat it. Right? So
They don't want to
but-
eat us. They just want us to get
Right.
the
So
hell
if they're
away.
protecting themselves and they're biting like a predator or like us, a lot of times they'll dry bite because they don't release their venom because they need that to survive.
I get it. Yeah.
And if they do inject venom, it won't be necessarily all of it. Now, if you get bit by a poisonous snake and it injects all of its venom, like then you're going to have some of the crazy systemic things that we talk. You know, like obviously the more venom it injects, the more severe the reaction we're going to see. But just something that people don't, necessarily like always know. So
Yeah, I didn't know that. That's interesting. All right, so now we're going to move on from snakes to other venomous things.
Okay.
Spiders. There's black widows, brown recluses.
Those are the two main ones
Those
that
are
we're
the two
going to
main
talk about for North
ones
America.
in North America. They're both found.
Everywhere.
Well, so black widow is typically southern, but brown recluses are everywhere.
Yeah.
Like everywhere. So black widows, if you don't know, they have that little like red hourglass. They're completely black. They're pretty small. I thought black widows for some reason were like tarantula big. They're like very small.
they're pretty small. Yeah.
Spiders. But they've got that red hourglass look on their
Butt.
torso.
On their butt.
I'm sure that there's a more scientific name for it, but not a spider expert. Chris is the snake expert. So that's how you identify those.
I believe it's only the females that have that as well.
Correct.
Yeah.
And
Because
they're
the
called black
males.
widows because they eat their males.
Yeah, right. When they like basically have sex with the male, eat him. Now they're a black widow, and they have.
I hope it's a good lay at least.
Yeah, I would hope so.
That's your last one.
Right? Yeah.
So that's black widows. Brown recluses. Okay, this article I read was talking about brown recluses and like how to identify them. Apparently, they have like, what did they say? Some sort of shape on their body. It looks like it was like, and then I'm looking at the picture. I can't even find the shape. Like it's a brown spider. It's a little brown spider. It bites you and it hurts like hell.
Yeah.
Assume it's a brown recluse. I suppose.
Yeah,
like,
that's kind of
it's a little brown spider. It's pretty much all brown. Its whole body is brown, and then there is like some people say that there's like this type of shape on its back that's pointing towards like its butt end, but I couldn't see it even in the pictures.
Okay. Yeah.
Now maybe I'm not the smartest.
And again, and they talk about different ways to identify these spiders, but keep in mind, and snakes. You don't. The goal is not to capture the creature that bit the victim to bring it in for identification. Right? We'll talk about that. Just don't do that
unless you've had the proper training. There's no training that I know of. We should start offering that though.
How am I going to offer
How
that?
are we going to capture the creatures? And then it's like a special certification. You get ACLS, you get BLS, and then you get like animal response.
Okay, we can create that.
Something
Can
to
I
think
just
about.
teach the beginning part where it's like run and hide?
Oh, you
Is
can
the
teach all
only-
about snakes because you know all about snakes.
all
You just
about
can't
snakes.
look it up.
Yeah, I just can't look at it.
Like, lastly, scorpions. Bark scorpions. They're yellow. They're very small, like 5 centimeters in diameter. Those are the ones that are like the big venom ones.
Mainly in the south and that sort of thing.
South and west, like California, stuff like that. They like to hide in shoes. Have you ever seen like the Indiana Jones movies where they're like dumping the shoe out?
Horrible.
They hide in shoes, like under. They're called bark scorpions because they tend to like hide under like wood and in trees. Things with bark.
Okay. Fair. That makes sense.
Like
Yep.
chocolate bark.
I don't think you need to keep telling me more, but yeah.
Anyway, those are the poisonous things. So we've got pit vipers, coral snakes, black widow, brown recluse, bark scorpions.
Okay.
Bark scorpions can be identified because they are yellow. So next, what I want to talk about is kind of what not to do. Kind of debunk some of the myths that you hear about what to do when you're bit or you're injected. Like people have
For
lots of
Envenomations.
ideas. Yeah. So what are some of those kind of quote unquote wives' tales that you've heard of what to do if you get bit from TV, not necessarily from your medical knowledge?
Yeah. So you don't suck the venom out.
Right. So if
as
you
a
watch an
general-
old cowboy movie,
Right.
a lot of times they take a knife, they incise the wound, make it bigger, and then they quickly suck the venom out of their mouth and spit it because the idea is we'll stop the venom from getting into the bloodstream by.
And that's not even like that. People like used to try that.
Yeah,
It
and then
just
they like get
doesn't
veneration from their mouth.
Right.
Yeah, I don't know why.
Like theoretically, you
No,
would think. No,
I get what you're saying. I get why maybe someone will come up with that, like the venom's
Yeah.
going somewhere. But like now that we know about
don't
like,
do that.
science, you know what that it's going right into the bloodstream. It's absorbed in the tissues. You're not going to be able to get enough of that out or any of that out, and you're just going to put yourself at risk. So
Especially
don't do
in EMS, where like the first thing we always do is scene safety, and then PPE. Sucking a wound,
Putting your mouth
is
on a
just,
patient.
like, should be general.
There is
like,
never a time now, and there used to be mouth to mouth, right?
Yeah,
but
yeah.
there is never a time that you should put your mouth on a patient.
general rule.
Rule number 1.
Yep.
Not just with Envenomations, guys. In any situation,
If I ever
do
write
not
a
put
book,
your mouth on
if I
this
ever write a
patient.
book, that is going to be like the rules.
It's going to
the
be
rules
called
of
mask up. Don't put your mouth on a
Don't put your
patient.
mouth on a patient. Yeah.
Okay. So don't do that. What are some other things?
Or the book will be called "What to Do with Your Mouth in EMS."
Keep it shut. So chapter 1, keep it shut. Be seen, not heard. All right, so don't suck the poison out. Don't tourniquet. Now, this is one that I thought for a long time was like a real thing. I thought, so the idea is, we tourniquet to trap blood flow in an area, right? To prevent blood flow going systemic.
Right.
So it would make sense, hey, let's tourniquet and keep the poison or the venom, in that compartment. So if I get bit in the arm, tourniquet the arm. Now it's not an issue. Not true, doesn't work.
Right.
Bottom line, we don't need to get in the science of it, but it doesn't work.
It doesn't work, and it puts the limb and that kind of thing at even more risk of, it's just...
Don't do it. Do not use extraction devices. So some agencies and places have these special extraction devices where they're little suction cuppy deals where you put them on and it's essentially sucking the poison out without your mouth. Yeah. They don't work. So don't use them. Like they literally don't. And I had to look into this a little bit too, because some of them legitimate agencies are kind of extraction devices. Emergency medicine does not recognize these extraction devices as working. Okay. If you have heard of one that does and it breaks some rules, write in about it, because I'd be interested to know. I didn't even know these things existed. Yeah. So it's kind of cool. And then the other thing is, you were saying, recovering the body, or it is important to try to identify. Don't go looking, but if you can identify what injected the venom, that can help the ER out a ton in terms of getting anti-venom and then knowing what mechanism is going to be potentially harmful to the patient. We're going to talk about kind of the two big mechanisms that happen with envenomation. But a lot of times people would think if the snake is dead, I can take the snake with me. So I found out last night that a snake head can still bite you up to an hour after it's been removed from the body. What? Like a chicken with the head cut off kind of thing? That's what it said. But basically a dead snake, maybe it was a dead snake and bite you. Maybe it's not when your head cut off. That makes a lot more sense.
So a dead snake, if the snake is dead.
Bottom line, if it's dead, it ain't dead. Don't touch the snake.
Don't touch the snake.
It can bite you and inject venom after
zombie snakes exist. Just even if
every snake is a zombie snake.
No snake is safe, and neither are you because of it.
Be terrified. We're an emergency preparedness company, but we want to let you know, be terrified. No one is prepared for this.
No one is prepared for this, and we
no
don't
one
even
is
know
prepared
how to
for the zombie snake apocalypse. So those are the 4 things: tourniquet, suck poison out, handling the snake's head or the dead snake, or using extractor devices. All of those are out the window. We don't do those things. So you might ask, well, what the heck do we do? Right. In this situation, you're going to find the answer is always the answer pretty much, is we're going to stabilize and we're going to resuscitate. We're going to treat symptoms. We're going to try to handle those issues. Understanding what we're going to be looking for is the important part now, right? You have all the tools as a medic or an EMT to be able to treat a patient with envenomation. Not to completion, you need to still get them to the hospital, but you can stabilize that patient. You have the tools. There's no special device or special technique that we do for venom. But if you understand venom's kind of mechanism of action, if you will, in the body, you're going to have a better understanding of what to look for and then how to aggressively resuscitate or get ahead of the, don't get behind the 8 ball. Gotcha. So 2 types of mechanisms. Why don't you go over the first one with us?
All right. So there's 2 main ways that venom, from a general standpoint, that when we talk about these venomous creatures, that there's 2 ways that their venom operates in order to, again, in nature, paralyze or kill their prey, and that can essentially affect us if we get bit. So envenomations, 2 things: coagulopathy. So certain types of snakes and certain types of envenomations cause coagulopathy. That's how it kills its prey. That's what we're going to see happen to our patients if they get bit by these types of things.
What does coagulopathy mean?
So coagulopathy is essentially that your blood starts clotting.
Right. So if we have coag, we're always talking about the clotting, right? Coagulation, the clotting, and then apathy. Anytime we have pathy, right? It's usually pathology. It's an issue with it. Right. So we either have too much clotting or too little clotting.
Yeah, a problem with clotting mechanisms.
So and again,
if you thin the blood out too much, then victims, bleed out internally. If you do it too much, then they form clots and have strokes and heart attacks and all. You know what I mean? So this is how the one type of venom will work.
Right.
That way.
And then the other type is neurotoxicity, and neurotoxicity is basically where we're dealing with the neurological system, and because of some things that are happening at the motor junction, we get paralysis, we get either partial or full paralysis, we can have issues with the brain, and we can kind of get into that. So typically venoms will be one or the other. It'll be kind of a coagulopathy type of venom, or it will be a neurotoxin type of venom.
And the neurotoxin, essentially, like, you know, how it kills prey or how it would kill a patient is that it paralyzes everything, including the diaphragm, including the respiratory, and then you stop breathing, and then you die. So that's kind of how
you always die for the same few reasons, right? Your heart stops, you stop breathing, your head gets chopped off. You can still bite for an hour.
I don't think humans can still bite for an hour.
I've heard the guillotine.
Those heads would that's not true at all.
So cool. So let's talk about coagulopathy a little bit more. So what happens a lot of times with snake bites or spiders or scorpion bites, this is more common in snake bites, the coagulopathy things, especially pit vipers, actually. So the big issue that we're looking for is hypotension because of the pooling of the blood.
Okay.
So the blood clots weird, and then because of that, we have what type of shock?
So blood clotting in the wrong areas in different parts of the body is going to essentially lead to a more, like, it's not an obstructive shock, it's going to lead to more of a distributive shock.
Right. You don't throw a PE from this necessarily, or you don't have a heart attack because of the coagulopathy, but because there's issues with coagulation of blood, oftentimes you have clots, microclots everywhere, and then because of that, you can't clot anymore because you've exhausted all your clotting mechanism, and now the blood's pooled and it can't. Now you're a bleeding risk and things like that. And we call that disseminated intravascular coagulopathy, or DIC.
Nope, DIC. Nope, incorrect.
I don't know.
Disseminated, no.
I'm looking at the outline. It says DIC on it.
Nope. It is disseminated intravascular coagulopathy, DIC.
Right.
Yes.
So if you get dicked, what happens is that's kind of the opposite of what you'd think. It's tons and tons of microclots everywhere. It's like your body is...
Well, and that's the thing. We see DIC in when the body's essentially shutting down. So we'll see DIC. I mean, the most I've come in contact with patients suffering from DIC is in patients who have been in the ICU for a long period of time. They're crazy septic for a long time. Their body is shutting down. So again, there's a little bit of confusion for people because we think that, like, oh, they're getting all these clots everywhere, which means that it's a clotting, like they're having excess clotting. And yes, but they're also having pooling and thinning of the blood in other areas because we're using up.
Because of the excess. So it's one mechanism.
It's inappropriate clotting in the wrong spots, essentially. We look at it that way. And because of that, we've used up all our ability to clot, so the rest of the blood is too thin and distributed incorrectly. So it's really both. So people are like, well, is it is the blood thinned out and they have a bleed? So these people will both have bleeding. Like when in the ICU, I've seen this where people are like, bleeding from their GI tract. They've got a GI bleed because their blood's too thin, and their fingers and toes are dying from necrosis because they have clots in those.
They have clots, and
so
it's cutting off the circulation.
It is both, and that's what this venom stuff will do as well. The pit vipers and things that their venom causes coagulopathy, you're going to get like a DIC where you see both microclotting in areas that it shouldn't be and thinning of the blood systemically because we're using up those clotting factors, which is going to lead to bleeding issues. So you're going to bleeding and clotting both.
And usually we don't usually see DIC with this type. In emergency medicine, we don't bump into DIC too often. We usually are bumping into it when people already have clotting issues, like they have like thrombocytopenia or something like that, where they have like autoimmune disorders, or they're taking medications that can kind of cause these issues. So that's what we normally see it. Venom is kind of like, oh, okay, it can also cause this from venom, right? It's not. I guess DIC isn't specific to venom.
It's not. Stop.
That's what I'm trying to get at. All right. So what's the big issue there from an emergency provider? Well, we have pooling of that blood, like you said, but bottom line is we have blood in the wrong places, right? And that's what we would call distributive shock. And shock is always going to turn into low blood pressure or hypotension. And now we have an issue that the blood can't get to the right spaces because it's being pooled. Now we're hypotensive, right? And these people can go hypotensive very quickly, and it can be pretty extreme hypotension because of the clotting is a big issue.
And that depends on how much venom was injected at the time. You know what I mean? That's another thing too.
And there's quite a bit of time can go by before you start seeing symptoms. So up to 8 hours later after an envenomation can you start to have serious symptoms of it. So So that's something to remember. If they got bit and they feel great, it's not like a bee sting where, oh, they had an anaphylactic reaction or they didn't. Like, nope, this isn't anaphylaxis. This is envenomation. It's a different mechanism.
Yeah.
And I think a lot of times people think that it's very similar. Like you talked about bees earlier. I don't think you thought that, but you talked about bees earlier. You know what I mean? It's the same thing. You got stung by something. Oh, he's having an allergic reaction to the snake venom. No, it's not how it works. You're not hypersensitive to snake venom. It actually has a process that it
differentiating between allergic reactions to stings and bites versus envenomation. So you got to know what, and that's why identifying these, like, so I'm sure there are snakes that bite and you can have a little irritation, allergic reaction, but if it's a pit viper, then you have to worry about envenomation. If it's a coral snake, you have to worry about envenomation.
We're not talking about histamine release and things like that. We're talking about coagulopathy, and we're talking about neurotoxicity. Toxicity.
You're gonna say if you say dick again.
So, the other thing too to look for is pulmonary edema from pooling in the lungs themselves. Sure. So you can get pulmonary edema, and now you're having shortness of breath because your lungs are filling with fluid. Because again, the blood is pooling in the lungs; it can't get out of there into the right spaces. So we start to have issues. So how would we handle those issues? Pretty easy. Manage the airway. You can consider, if you have pulmonary edema, you can consider, CPAP, BiPAP, those sort of things. Aggressive controlling of the airway as always, and then also fluid resuscitation for the hypotension, right? We're not necessarily fixing the problem. We're putting a Band-Aid on it by giving more fluid to charge the vessel so we can perfuse. Yeah. With neurotoxicity, if you remember anything about basically how a motor neuron works, there's basically that synaptic cleft, right? So you have on one side, the motor neuron, the other side you got the axon, and then basically you have to have the chemicals travel over that in order to send an electrical signal. It ends up becoming electrical in a way. Mm-hmm. Cells move very fast. Involved in that process is acetylcholine, and then there's acetylcholine reuptake, and there's acetylcholine esterase, which destroys acetylcholine, and there's that whole situation. So acetylcholine gets released into that motor junction in order to activate a response. So if you're going to flex a muscle, that's happening on a 1/1,000,000th scale, and it's happening across the whole thing, millions of times. Within that, and you can do some research on that, look into that if you're interested. It's more of an anatomy and physiology thing, not something you have to know a ton about for EMT or paramedic. But what's happening there is that you have acetylcholine being blocked at receptor sites so that it can't bind to receptor sites, and therefore is just kind of free roaming, and then we can't have the motor function happen, right? We can't activate that impulse, right? So that's what causes paralysis.
That neurotoxic venom essentially is blocking acetylcholine in the motor at the motor neuron so that you can't move.
Right. And this can happen in pretty much any neuro-like symptom. So you can get poor brain function and things like that from this, but more likely, especially in the localized area, you're going to get paralysis,
numbness,
and
tingling,
you can start losing function, and then because of that,
actually, that's a question. Do you get numbness, tingling, and that sort of thing? Because that's more of a sensory.
Not always. So we'll talk about general bites too, just some of the things that you might bump into, and that's kind of a common thing with a general bite because there's more to it than just like this is the coagulopathy venom. It does. Yeah. We have hundreds of antivenoms for each to a specific creature because they do a lot of different things. Yeah. You might actually too, like I didn't really touch on this, but you might get a venom where you're dealing with a little bit of neurotoxicity and a little coagulopathy. Yeah. So it all kind of depends on the creature.
But these are the two main mechanisms, and that's why we have to aggressively fluid hydrate we got to know what we're treating because we know what's going on. I'll speak too on a little bit like you mentioned antivenom. So if essentially if the reaction is severe enough, we need to get these patients antivenom. Now, every hospital does not carry antivenom. Most hospitals don't carry antivenom. So the way it works is that that's one thing that you should know for your EMS agency, your hospital, that sort of thing, is where would you get these types of things, right? Mm-hmm. Some places might not have access at all. Some places might need to call like the government and get it shipped to them in some way, shape, or form. For instance, in the Detroit area, all the antivenom that we have access to is at the Detroit Zoo. So, Jason,
they have the snakes,
because they have the snakes. So, and they have to have the antivenom on board in case one of their handlers gets bit and that sort of thing. So, you and I have done most of the training for the Detroit Zoo, and we really appreciate being able to work with them and have had some cool experiences with them, working with their people. But, and we've been able to talk about that with them a lot. So the hospitals in the Detroit area usually have a way in which that if they needed it, they could get the antivenom from the Detroit Zoo.
Yeah.
So you got to kind of know is that there's no money to be made in making antivenom, right? So no pharmaceutical company wants to make antivenom because people aren't buying antivenom, right?
It's not. Yeah, and it's not so much that it's a rarity that people get venom in their system.
Right.
It's a rarity that it's going to be that specific venom, and they're going to be able to make bank on that one type.
So they don't make a bunch, which means that we don't really have much. So you know what I mean. So there are pockets of areas where you just know where you can get that, and obviously your hospital is going to know where they can get it if they need.
And some hospitals, a lot of times, they'll carry a couple of different types of like common antivenoms. So like they'll carry something to handle, like if you have a certain type of snake in your area, like in Michigan. What do we have around here? What's it called again? We have one pit viper in Michigan that is dangerous, and it is called. Jamie, help me out here. Jamie, what's that pit viper that we have in Michigan?
You asking the camera guy?
It's called. We're gonna cut. I'm gonna look it up, and then I'm gonna say it.
Okay.
So in Michigan, we have something called the Massasauga, Cisternus catenatus, which I know a lot about.
You just looked that up.
And
Literally just looked that up. I watched you look that up.
And it is a pit viper because it's a rattlesnake.
Right.
And that's the one we have to worry about. Anyway, local hospitals might have antivenom for that specific species is what I was trying to get at, but not like all of them, right? They're not going to hold coral snake ones around here. So, yeah. To your point, this is why it's so important to get the ball rolling with communication early on, which we'll talk about in a minute. But like, you got to let the hospital know because it's going to take time and resources to get that antivenom and like get the long-term treatment and know what they're looking at. So again, our job most of the time, yes, we're going to be doing aggressive stabilization and resuscitation if we're losing these patients. But the biggest thing that we can do is get the definitive treatment ball rolling by contacting the hospital, trying to let them know what bit them, what kind of signs and symptoms we're seeing, and then they can know, okay, we've got a Massasauga, envenomation. We need to get that antivenom. We need to get prepared. These are the things.
And sometimes too, like I said, if you don't have access to the antivenom, even in the hospital, it just becomes very aggressive supportive care until that venom works its way out. So we have that. That sometimes is all we can do as well. And then another thing too is that there's another resource. Obviously, you have is poison control.
Yes.
So we can talk about that really quick. So
yeah. So poison control is 1-800-122.
No. 1-800-222-122.
222.
Yes.
So all twos except the one and the last four digits.
Yep.
So it's easy if you remember.
222-1222.
Yes. Yep.
So and that's across the board. So that'll put you in touch with your local.
Have you ever contacted poison control?
Oh yeah, all the time.
They're super nice.
Yeah.
Every time. Like they love to hear. I was surprised. A lot of times as an EMS provider, like I call and I'm kind of like, oh hey, like it's me. I'm sorry to bother you because you don't feel like poison control will talk your ear off, man. Like they love. I don't know if maybe they're just not utilized that much. That's why. But like, they are like so friendly. Like, will like give you some backup. Like, let you know what to do. Like, they're super. They love it. Like, I think sometimes with the false activations of like 911 and stuff, like you expect like dispatcher like people to just always be jaded because it's abused. Poison control is not that way. They're like, thank you for calling. Let me tell you everything.
Well, what's cool too, and this is kind of more for physicians, but I mean not necessarily. So Michigan's poison control is based in the Detroit area. So when I was able in residency to do a couple toxicology rotations with the toxicologist who literally worked with, and I got to like meet some of these people who answer the phones and all that kind of stuff. So literally like I'd be in like a lecture and one of these operators would come over and be like, hey, Dr. So-and-so, this person on the phone has a question. He'd pick up the phone. He'd be the toxicologist for Michigan and pick up the phone and like start to talk to you through. And they love that. I mean, that's like their jam. They love that stuff.
That's cool.
They're like, they hope people get poisoned.
No,
I'm just kidding. but they do. They're really, really kind. There's a lot of resources, and they've got, they will answer all your questions, tell you what their recommendations are,
and they'll help get the ball rolling too. Because like
Right.
just calling you might not necessarily, because you're like, I don't know who to call. You
Right.
probably call poison
call
control.
poison
If I'm
control as well.
already like, hey, I called them. I've already told them what hospital I'm transporting to. They've already contacted the zoo. They're gonna say, you know what I mean? Like they're gonna figure out things for you, and they're rare circumstances, so we do need to have some special resources, and that's what they're very good
they're
about.
Definitely a great resource.
So anyway, the last thing I just wanted to talk about too was before we get into emergency treatment and stabilization.
Well, really quick, do you want to talk about like neurotoxins? So like, what am I trying to say? Black widows. Black widows inject a neurotoxin.
Yes.
We talked about the neurotoxins. I just like we said, pit vipers are usually like the coagulopathy type of thing. Black widows are a neurotoxin.
Yeah, and I believe
most
too.
Scorpions,
don't quote me on this.
Scorpion's probably a neurotoxin.
Again, there
as
can be
well.
combinations of both, but I think coral snakes tend to be the neurotoxin over the
okay.
coagulopathy. I don't know for sure. Don't quote me on it, but I think that's from my research last night. I think that's what we're going. I started getting weird. Like instead of like looking at the medical stuff, I just started like learning a lot about weird snake stuff, and then got myself freaked out and then stayed up all night. So
and then brown recluses are a little bit different. So brown recluses actually, when they bite, they essentially inject like a venom, but it's more of a like causes like a necrosis.
Yeah, and this can happen. We'll talk about general symptoms too, but yeah, especially brown recluses, we're more likely to lose like a limb over.
If it's a big enough,
kind of a scary thing. So general symptoms that you can see: nausea and vomiting. Very normal shock-like symptoms, right? Diaphoresis, swelling and necrosis can happen pretty much at any bite site. So swells, area dies, right? Necrotic tissue, it's going to like be brown, gray, it's dead, black, dead tissue. And this can spread. And that's why we always thought like, oh, we'll tourniquet, but that doesn't work. One issue that you can have, some people talk about compartment syndrome with envenomations. Well, what's happening there is the swelling is so bad and it's circumferential on a limb that it cuts off circulation to other areas, and then what you get is a compartment syndrome where you have that blood sitting in that area, it can't get out of that compartment, and now we deal with compartment-like syndrome. So that area gets really tight, reddened. It can be very painful.
Lack of blood flow.
Then more necrosis of the tissue because of that.
Yeah.
And then we have to be careful. This is more of a hospital job, but as they start bringing circulation back into that area, all that anaerobic metabolism happened there. So you have all this nasty stuff that's going on. All those toxins are going to then go systemic once we get blood flow back. So we have to be prepared to deal with those issues.
And that's part of the reason that the tourniquets, one, they didn't really work to prevent the systemic things, but they were preventing blood flow to the limb that was affected, which was expediting the necrosis, expediting the damage.
It wasn't trapping the venom, it was just trapping the blood.
Yeah, exactly. And you almost want that blood flow to circulate so that you can kind of dilute the venom as it. So it's kind of this balance between like we don't want it to become systemic, but at the same time we do kind of want to dilute it. So again, that's why tourniquets probably don't work.
Yeah. So you can see compartment syndrome. One thing to keep in mind: removing your jewelry on the patient, like probably anywhere.
Yeah.
Just remove it, because what happens
bracelets.
is if you do start to swell in that area or you get that compartment, now you can't get that stuff off because it swelled too bad. Shock in general, main shock that we're always going to be kind of big worried about is that hypotensive shock from, a distributive issue. So if we start to see low blood pressure, it'll usually be pretty significant and it can happen very quickly. So be prepared like that, have a line started, and then give fluid if they start to go hypotensive, just to keep them alive and for enough time for us to handle the envenomation issue at its core. And then airway issues too. So because of the neurotoxin or the pooling in the coagulopathy in the lungs and the pulmonary edema, you can run into big airway issues. So aggressive airway management is going to be important too. And then depending on the bite or sting, there are some that won't have much pain at the site at all. You might not even be able to locate the site.
Yeah.
There are others that have extreme pain at the site, extreme pain at the site.
So pain control.
Pain control is very important. Icing the area for swelling. So yeah, some of these they always describe it in the textbooks and stuff as exquisite pain.
Exquisite.
Like you're some nasty megalomaniac supervillain that's like, it's exquisite. It's exquisite. But no, exquisite pain. Like just incredible pain. Worst pain they felt in their life in that area. So we are going to treat with pain management, aggressive pain management. You don't need to be scared about bottoming these guys' blood pressure out. That's why we're giving fluid in the first place. Treat the pain. Yeah. It's going to be the worst moment of their life. Sure. Treat the pain. So let's just touch on that before we close. We'll just kind of touch on emergency treatment and stabilization options. So scene safety and PPE is super important. The fangs of whatever's biting or the stainer of what's staining rarely breaks off and stays in the wound. So it's not like, bee stings, they kind of teach us take a piece of paper and try to swipe it away. We usually don't have to deal with that. That being said, if you are handling the area and you think that there's a piece and you need to remove it, you need to have proper PPE to remove that. Latex gloves ain't going to do it because the fang's going to cut through and then, hey, guess what? You got venom in you now, right? Yeah. So use the proper PPE in order to do that. Be very, very careful with handling any of that stuff. Make sure that the scene's safe. In my case, that means there's no snakes within a mile radius.
Right.
Dead or alive, because they can come back to life.
Like Indiana Jones, if your victim has fallen into a pit of snakes,
Don't go down there.
Yeah, I mean, I'm not doing that.
I wouldn't go down there with protection, with a hazmat suit.
No,
I would not go down there.
Not.
I lost a train of thought. All right, so
PPE.
identify the species if possible, right? And that can be difficult to do. I don't know. It was a snake. I don't know. It had some colors, or it didn't have some colors. It looked like a rattlesnake. We don't know, right? Especially because there's so many different species of pit vipers and rattlesnakes that we can deal with. We might not be able to narrow it down, but at least we can say, hey, it was a snake. It had a rattle. It was in this area. We can start. We can start narrowing
I don't know.
things
Let's
down.
check it out. It's right here.
Yeah,
And
don't
they
pull the
just,
head
like,
out. So, identify the species if possible. Call poison control and get early communication with your medical control right off the bat. Hey, I believe we have an envenomation. Even if the patient doesn't have symptoms, because remember, it can be 8 hours later, right? So, hey, we have a possible envenomation. This is the snake that we believe it was, or this is the scorpion or spider. I've contacted poison control. This is what they're telling me to do.
And we'll monitor these patients in the ER for about 8 hours or so. If we know that there's a possible envenomation, we'll wait that time out if we need to.
Yeah. Could you imagine just sitting there, bit by snake, waiting to die?
Hoping you don't get symptoms.
Ice and pain control. Ice is important to control the swelling and to numb the area. And then pain control. Use your morphine. Use your fentanyl. Use your whatever you use. Your ketamine. But it is okay to sedate these patients and give them good pain control because they're going to be in a lot of pain. Airway management is going to be the big, first thing that we do. Follow your ABCs. Aggressive airway management. You may need to bag these patients. They might lose their airway. Intubation might be important. And then aggressive fluid management if they go hypotensive. So just keep in mind, we're watching for these things. We're watching for hypotension. We're watching for airway issues. We're watching for extreme pain in the area. We're watching for compartment syndrome, right? That's why this is important. We know the tools. We know how to handle hypotension. We know how to handle an airway issue. But knowing what this toxin does to the body, we know what to watch for, and we can kind of never be behind the 8 ball and be more prepared for what we could see.
And then again, we're not tourniqueting anything. We're not putting our mouth on anything. And those kind of things that we're just gonna not do that stuff.
Right.
That's a bad idea. So cool. Awesome. No, hey, I like it. Yeah, I think that pretty much sums it up. So hopefully that kind of gives you guys a good overview of envenomations, kind of how to handle them, what to look for, and also you realize now that you should hate snakes as much as we do
and stay away from them.
We
just learned that there's a snake upstairs. And I'm terrified now.
We did. So we may have paused in the middle of this to do a quick edit, and our videographer told us that there is a snake in the building, and just that is bothering me. So it's time to sign off.
We're going to take a month hiatus.
Thank you guys for taking the time. We want to thank Elite Medical Training again for sponsoring us today. Check out their website at elitemedicaltraining.com. See what they're up to. We will see you guys again next week, and hopefully with a better topic. No, I'm just kidding. This is good. So, all right, guys. Thank you so much, and have a good one.
Stay sweet. Hey, guys. Hope you enjoyed the episode. If you're an EMT or medic student, or an advanced EMT student, or an instructor of those students, we have a program just for you. With Sights and Sirens NREMT prep program, you get video lectures, over 15 hours of really vetted, great content to help you through your program and help you prepare for the test. Check it out at www.sightsandsirens.com.